Welcome and thank you for attending this presentation of Transforming Grief into Growth by Sophia Antoine Doula of Devout Doula Services. I'm so glad you're here. Before we get started, let me go ahead and give you a trigger warning. The following presentation will include topics related to pregnancy loss, stillbirth, and abortion. These topics can be deeply emotional and triggering for some individuals, particularly those who have had personal experience with these issues. So what I'm asking you to do is, if at any time you feel triggered, if at any time you're feeling like you have to step away, please do so, because it's not necessary for you to sit through the entire presentation, even though it's short, and feel the way you feel. Honor yourself by stepping away, because that's what's most important. Your mental health is most important. So again, thank you for attending, and please take care of yourself. So I'm Sophia Antoine, and I'm a full spectrum doula, a childbirth educator, a PALE advocate, and PALE stands for pregnancy and infant loss. I also do end-of-life doula work. I also do abortion work. I do anything having to do with reproduction, anything having to do with life itself. I am there to provide support, okay? And most importantly, I'm passionate about all things birth and postpartum. It's my dream, oh my gosh, it's my dream for all birthing people to have an experience that leaves them feeling heard, seen, respected, and valued. So today we're going to address 3 types of loss. That's abortion, miscarriage, and stillbirth. So let's start with abortion. That's a choice some women make based on personal, medical, or other reasons. And I say choice because the doctor won't perform the procedure without your consent. Actually, a doctor shouldn't perform any procedure without your consent. But abortion, as you can understand, is really different. It's deeply personal, and it comes with as much grief as the miscarriage or the stillbirth. So possible reasons for abortion. Before we go over this list, let me tell you that it's not just because of irresponsibility in, a woman's or a person's reproductive practice. I did not put this on the list deliberately, simply because that's usually like 1% of the reason why someone has an abortion. So it could be for a life-threatening health condition or fetal abnormalities that, the fetus won't be able to have a sustainable life outside of the womb, financial circumstances or difficulties, just the timing of the pregnancy and life, rape or incest, lack of support, contraceptive failure, ability to care for other children if you bring another child into the home, age considerations, and relationship considerations, say like a domestic violence situation, and you don't want to subject that child to that. So miscarriage. And now that's a term referring to the unexpected end of a pregnancy. Like you really wanted this baby, and for whatever reason, before 20 weeks, the pregnancy wasn't viable. And it occurs due to natural causes most times, chromosomal abnormalities, which are beyond our control. A list for possible reasons for a miscarriage, that could be, again, chromosomal abnormalities, uterine abnormalities, incompetent cervix, which sometimes if the person decides to get pregnant again, they end up with a cerclage, which is a stitch around their cervix to help keep it closed. PCOS, there's other chronic health conditions, immune system disorders, lifestyle factors like smoking or drugs or things like that, advanced maternal age, medications or treatments, say like, oh gosh, that just escaped me. The one for cancer. So you know what I mean, and environmental factors. So just things like that. Stillbirth, an experience that's heart-wrenching. It refers to pregnancy loss after 20 weeks. So this is usually after you've already felt the baby kick, or you felt the baby move or flutter, things like that. So that is heart-wrenching, because now, before you didn't feel anything, so the pregnancy although you knew it was there, it's even more real because you know there's a little being like moving around and kicking and is actually living inside of you. And then to have that all ripped away, and usually after with a stillbirth, you still have to go into labor and you still have to push. So that causes profound grief because it's not the ending that you hope for yourself or the baby, of course. Possible reasons for a stillbirth. There could have been problems with the placenta, birth defects, some sort of infection during the pregnancy. Again, a chronic health condition, something is wrong with the umbilical cord, or some sort of accident or trauma happened with the umbilical cord. Trauma to yourself or an injury to yourself. Maybe you fell, maybe there's a car accident, something like that. Preeclampsia, multiple pregnancies when there's more than one baby there. Maybe you have one and then the twin or the triplet, another one of them didn't make it. Delayed birth, maybe you're in labor for a long time and you don't get to a C-section in time, or RH disease. Now, emotional health after loss, because those were just reasons. We just defined what the loss is, but the reason we are here is for your emotional health after loss, because we want you to grow through this, not only go through this. So experiencing a loss, whether through abortion, miscarriage, stillbirth, or any other means, can have a traumatic emotional effect on the birthing person. So you're not going to deal with it the same way your friend or your neighbor or someone across the world will deal with it. So don't compare yourself. I think there's a phrase or a saying, comparison is the thief of joy, because you expect your experience to be like somebody else's, when in all actuality, what you're seeing probably is their exterior, the face they're putting on for you, not necessarily what exactly they're going through. So professional medical and psychological support is often beneficial during this time. So if you need the help, seek it out. There's no shame in that. So you could possibly experience grief, which is sadness and mourning and crying and all of those things. You can possibly experience guilt. Feelings of guilt or self-blame happen because you think you did something wrong, when in all actuality, you probably didn't, and things were probably beyond your control. You can experience anxiety and or depression because the emotional toll of the entire situation is weighing heavily on you. So not only the loss itself, but it's the loss of the dream of what could have happened with this child and, you know, the life you could have had. So you have to mourn that as well. You could be angry for a period of time. So be frustrated or just lash out at other people or yourself. Emotional numbness. Maybe you don't feel anything at all. You could feel detached and just not feel nothing for a period of time. And there could be some PTSD in there too, where you maybe don't want to try again if it was an unintentional loss. Maybe you don't want to try again, or you're scared to try again, and it affects you adversely. So before we go any further, let me tell you about some signs of depression, just in case you're having these. And these are prolonged and persistent symptoms, because we can have any one of these things from this list, and there are more, but these are just the most usual. We can have any one of those things as a one-off. So don't get scared and be like, oh, I'm depressed, or I've been depressed forever, because you've experienced this for a period in time. So maybe a day, maybe two, but if it's going into 2 weeks, 2 months, 2 years, definitely seek help. I'm encouraging you to seek help. So if you have no energy for a prolonged period of time, pulling away from usual activities. Of course, when the loss first happened, you're not going to feel much like going bowling or hanging out with friends, things like that. So we know that. But if after, say, a month, you've not smiled, all you've done is cry, that's the time for you to seek help. You're eating or sleeping too much, and I would say even eating or sleeping too little. Experience severe mood swings. You're going, from one end of the spectrum to the other really quickly all the time for a prolonged period of time. Hopelessness or helplessness, having unexplained aches, because things that you don't let out will manifest themselves in your body as pain. So a lot of times you're thinking, oh, my knee hurt because I hit it when I was 6, when in all actuality, it's that suppressed pain that's manifesting itself maybe in your joints and you don't know why. Okay, thinking of harming yourself or others. Now, in this day and age, this particular feeling, I wouldn't say is normal, quote unquote, because nothing is ever normal, but it's a fleeting thought. Fleeting thoughts are things that pop into your head and pop right out. But if you're having this thought on a daily basis, or it's a thought you're having all day, say something. I would say something anyway, just to let somebody know this is on your radar. But if you don't intend on acting on it, if you don't make a plan and things like that, I wouldn't worry much about it, because it's, like I said, fleeting thought. It pops in, pops out, not every day. But if it's something you start planning, if you start giving away your stuff, or if you're watching this as a friend and you see somebody starting to give away their things, or kind of look like they're making their quote unquote final arrangements and things are just off, seek help or find somebody to go check on them, get a professional involved, because we want to go ahead and deal with this right now. And again, feeling numb. The thing that's going to help you grow through this particular situation is going to transform your grief is, there are 3: solidarity, forgiveness, and support. And pictured there, it says forgive yourself, because there's no one that you're going to blame more than yourself in this particular type of situation, in loss, but you, because you were the one carrying the baby. You were the one that was supposed to protect the baby. And if this is a support person, maybe, this will give you insight into the birthing person's feelings, because maybe you don't understand why they're going through the things they're going through, because it's a lot of self-blame. So these three things will definitely help you get on the road to growth. So solidarity. Unity or agreement of feeling or action, especially among individuals with a common interest. We're going to say that again, common interest, mutual support within a group. So pregnancy loss doesn't exist in a bubble. There are many people, whether they know it or not, that have probably experienced a pregnancy loss and don't know it. But for us, myself included, who knows what it's like to miscarry, you don't talk about it. And there's this saying of what happens in this house stays in this house. And that's not good for anybody, because so many people outside of your house have had this particular experience. So if I can come talk to you about it and you've already gone through it, maybe you can guide me. But if you keep it to yourself and I keep it to myself, we're both in our houses suffering. So one of the first steps I would encourage you to do is to share with others, not just within your immediate circles, but go to a support group and, talk to people who've been through it. And maybe somebody who had a loss 2 months ago can speak life into you because you just had your loss last week. Because that's going to connect you. You know that person has gone through the same thing, and you see that although it's not great, life does get a little bit better, and they empathize with you and they can understand where you're coming from when you express the way you're feeling. Next, every emotion, whether it's sadness, anger, guilt, or whatever the heck else you're feeling, has a place. Your feelings are valid. You're allowed to feel them, because if you weren't, you wouldn't be feeling them. So don't deny them. Don't judge yourself, and don't judge other people for what they're feeling, because all of us deal with loss in different ways, and we have to be here for each other, to uplift each other, to empathize with each other. Forgiveness. Is it your fault? That's a resounding no. Even if you chose abortion, that's a resounding no. It's not about fault. Feeling better, growing through this is not about fault. Later for that. what you need to do to forgive yourself, recognize your emotions. And this is where journaling comes in. And attached to this presentation is a downloadable journal. If you can print it, please do. If you can get somebody else to print it, please do. If you can't, that's totally fine. Grab you a notebook. They got them at Dollar Tree. They got them at Family Dollar. They got them at Walmart. They got them at Target. They got them at any store you go to, probably at a Circle K or any other convenience store. Grab a notebook and a pen, pencil, a crayon even, and write your feelings down. Write down, answer the questions that are in the journal. You don't necessarily have to download it. You got a smartphone, download it, keep it on your phone, and just write. All I would ask you to do is put your journal away in a safe place where nobody can find it, where nobody can get to it, so you can just write and get these things out of you, okay? Avoid blame. Challenge the thoughts that make you want to blame yourself and make you feel bad about yourself. Okay, so this happened, whether it's abortion, miscarriage, stillbirth, it happened. That's the hardest part. The hardest part is that it happened because this baby is not here. That's the hardest part. What you have to do now is make this child's life mean something. So create a personal ritual or symbolic act like planting a tree, lighting a candle. I would even go as far as naming this child. I would go as far as creating a whole story for this child, because when things are amorphous, which meaning they have no shape or they have no form, it leaves your mind to wonder. But you have the power to give this child, this baby, a shape, a form, a name, everything. Anything you can think of, it's all in your hands. And now, if you have other children or you choose to have children afterwards, you can provide them something concrete, provide yourself something concrete in a way that helps you deal with the loss. At the same time, have this child included in the things that you're going through as a family. Maybe you can celebrate birthdays together. Maybe you can celebrate other family activities. So it's not like you're casting the thought of this baby away. They're included because they were a part of your life. So you're just keeping that up. Allowing time, allow time to pass. Recognize that self-forgiveness may not happen overnight. And newsflash, it won't. It really won't. It's a process that takes time, patience, and repeated, I'll say it again, repeated effort. You have to work towards it. Support. Support can come in various forms. Employ one or all of these methods to see what works for you. Get a therapist or a counselor. There's nothing wrong with going to seek mental help. We learned that throughout the pandemic. We learned that, it's okay to go see somebody, talk about the things that are bothering you. It's okay to take medication. You can also tell your therapist, I don't want to stay on meds for long. I just want to feel better and then I want to wean off. Or if you feel like this is something you want to do continuously, hey, I want to stay on these because I feel better. And both of those choices are okay. Attend in-person or online meetings, whatever works best for you. I love in-person meetings, but I also love online meetings because I can be on the go and still attend and still listen in. I can participate and, I don't feel any different. But not everybody is good with online meetings, and that's okay too. Find something in person, and you know what? If there's not one available, you start one. You be the catalyst for change because you can be. You're going to help somebody else by, making this available and letting your community know, hey, I went through this. I want to share my experience, and I want to make it a safe place for you to share yours too. Get practical help. Now, if you have other children at home, or you just have a big house, or whatever the case may be, or you're just not feeling it. It's okay to not feel it. Get somebody to come in and help you with daily tasks around the house, sweeping the floor, mopping, making meals, childcare. That can be a big load off, especially when you're in the early stages. You want to do that stuff. You want to lay in the bed and just melt into the mattress. You want to become a couch potato, and you have every right. I support you in being a couch potato. but don't stay there. That's the only thing. You can fall down. We're entitled. Fall down as many times as you want, but just make sure you get back up. So employ your personal spiritual practices. Meditate, do prayer, do yoga, whatever it takes, chant, whatever works for you, do it. Try something new, because something may work that you've not tried before. Explore. It's okay. And again, my favorite, art and writing. Write down whatever you feel. Draw a picture. I don't care if you draw the worst stick figures. Draw them. My stick figures are horrible. I can't draw fingers, hands, toes, nothing. But just moving my hand, putting pen, pencil, crayons, markers to paper, and even if you scribble, angry scribbles, get it out. Because you're doing something, you're channeling that energy somewhere else, and it's not welling up inside of you and causing you to feel bad about yourself or explode on somebody else. So what's next? There's no denying that a pregnancy loss leaves a gaping gash in our hearts. You're not alone, though. Your strength is there, even if you don't feel it, or even if you feel like it's non-existent, it's there. But most importantly, your loss does not define who you are. It does not. It's an experience that you've had in your life, like you've had any other experience. It's a part of your story. It's a part of why you exist in a community to help other people. We heal together. Think about scraping your knee when you were young. Well, I know I did. And it was all open and bloody at first. Then it got cleaned and you started seeing the scab. Now, after the scab goes away, you start seeing little flecks of skin start coming back. All those pieces of skin, all the skin growing back, that's community. So a little bit at a time, the skin fills in, and then a little more fills in. So this is how healing works. In a community, we all fill in the gaps that one person is having. And then when that person's healed, they can become a part of the healing for other people. So I know it's a weird analogy, but it's what came to me, and I think it works. So maintaining positive mental health. Know your feelings are valid. I don't care what you feel. You're feeling it, it's valid. You're part of a community. Sometimes you got to get out there and be part of the community. What happened in this house stays in this house. That's not working for us anymore. We have to get out there, because a community can't be a community if everybody's in the house. What's a community center? Where people of the community come to gather. And I'm just saying community way too much, but people come together. That is what make the center a community center, because you're welcome to come there. Anybody that lives around you or wants to be friends or finding something else to do, they come there and you engage in activities together. So engaging in activities isn't just about fun stuff. Sometimes it's the down and dirty stuff you usually don't talk about, but we got to get it out there because it exists. Healing takes time. Be patient with yourself. Give yourself space to grieve. Give yourself space to be yourself, to rebuild. There's no right way. Nobody has the handbook on grieving, because if it was down to a science, it probably wouldn't even happen anymore, but it does. So this is one of the things that you can't control. You just got to go through and know that good feelings will return eventually. Now, going back to our list on depression, if it's prolonged, seek help. But no, your favorite movie or your favorite comedy or your comedian may not make you laugh right now, but in a couple weeks, you can go back and watch, and maybe it does. Maybe it's just you start off as a little chuckle, and then a month down the line, you'll be laughing out loud again. So no, this doesn't last always. You just gotta be patient with it. So I'm here for you. If you have any questions, comments, or concerns, please feel free to reach out to me. Your experience is my priority. This isn't an easy thing to go through, but you can grow through it. You can make your home stronger, your family stronger, your community stronger by growing through it and then helping others. So thank you so much. I appreciate your time and attention. I hope that what I've given you today will help you navigate these challenging experiences. My contact information is below. Please reach out should you find you need anything.